Yeah, walking after hip replacement is fantastic exercise. People often ask, why have you not referred me for physio after my hip replacement? And oftentimes we don't do, and that's because normal everyday activity, and to sit down you need to flex the hip to 90 degrees. To stand up you have to maximally extend the hip. So you don't really need to do range of movement exercises with the hip. We're telling you not to by, if we're having hip precautions, they don't flex the hip too much. And then the muscles around the hip, the balancing muscles around the hip have to work so hard just to walk. So when you walk, you're obviously standing on one leg, intermittently, one side to the other. So the muscles, because of the mechanics and the levers around the hip, the muscles have to work so hard just to balance the body weight on top of the hip, that the force they have to create by doing that is far greater than lying on your side lifting your leg in the air. Right. So kind of those kind of exercises, whilst they're really helpful sometimes for coordination, and those kind of things, and working on specific exercises, in general they have to work a hell of a lot harder just to walk. So I tend to advise patients, just take it easy, get out for a little bit of a walk every day, and gradually increase the distance that you're doing. And then we'll touch base at 6 weeks, and then we'll see if you need specific input, or you can just be let loose and just go for it.